Thank you, Governor. First thing I'd like to do, if you're a member of the North Carolina Senate and you're here, or if you're a staffer for the North Carolina Senate, if you just raise your hand. I'm sure the Speaker will recognize the House folks, so don't feel left out. But because, you know, these are the folks that made sure not only that we got this done, but that we got it done right. And so they deserve a great deal of credit. You know, 12 years ago, North Carolina had a broken Medicaid system. There was no way that system could have handled an influx of hundreds of thousands of new enrollees. We in the legislature undertook transforming the program from a fee-for-service model to a managed care model. That provided us with better budget predictability and put more focus on quality of care. Now we have a Medicaid system that is stable. By transforming our state's Medicaid program, we're now in a place where our system can handle those additional enrollees. But just because we have a stable system doesn't mean we can give hundreds of thousands of people new insurance cards without consequences to that system. That's why it was imperative that in expanding Medicaid, we address the availability and cost of health care. We were able to chip away at those issues with this bill. The Certificate of Need reforms in the bill takes direct aim at regulations that are the biggest impediments to the availability of health care and the regulations that increase cost. These changes will make North Carolina more attractive for providers, healthcare facilities, and hospitals willing to do business and to compete here in North Carolina. So while this is a momentous occasion, our work is not done. We need to continue to forge ahead with additional supply-side reforms. We were able to make a good dent in reforming our state Certificate of Need laws, but we can do more to remove the red tape that healthcare facilities and providers face in North Carolina. We still have a provider shortage that hurts our rural communities. Medicaid expansion will not solve all the problems our citizens encounter when they seek care. But if we see this as an opportunity to further chip away at archaic rules that prevent our citizens from accessing care, we can enhance real and measurable access to health care here in North Carolina. I look forward to continuing to work to remove those barriers to care. Again, I want to thank you, Governor, thank you, and legislators and legislative staff, thank you so much. And now I'll turn it over to Speaker Moore.
Good afternoon. Well, it's an honor to be here today, and it is especially exciting to see so many of my colleagues here. I would say if you're a member of the House, please raise your hand as well. Got a few of them, and it's the House staff as well. You know, this has been a long day coming, but it's been one as a result of a lot of reforms that Senator Berger mentioned about earlier, where we changed the way Medicaid was funded in North Carolina to go from a fee-for-service to outcomes-based, and it has saved hundreds of millions of dollars all these years. It's allowed us to be in the position that we're in today to be able to expand this coverage. But you know, this is only one part of access to health care, Governor. We all know this. You know, we talk about access to health care in terms of who's going to pay. We have areas of our state that still are underserved in terms of if you have a medical emergency, will you make it to the hospital in time? Can you get access to those providers you need? We know there's a significant shortage when it comes to behavioral health, and we see that all the way through the system affecting education, jobs, the criminal justice process. We know this is going to absolutely be an amazing opportunity to make great strides in that direction. The amount of money that's going to come in through the hospitals, through HASP, to put more money into direct care, to provide services to rural areas is something that will be of a generational impact. As we work through this process, I do have to give a shout out to, I know there are folks here who are providers, folks from the hospitals, a number of stakeholders who've been involved. Thank you for the tireless efforts you all have made over these last few months. We got really close last year, and we realized that we probably weren't quite there, but we could get there this year. And I'm very fortunate that we're here on a nice spring day with the dogwoods blooming to be able to see this sign. So, Governor, thanks for having us today, and congratulations.